Now live. Welcome back to another one of our Courage sessions, the first one of 2021. And what a year it's been already. Hopefully everybody has made it successfully to the other end of those terrible winter storms we had here in Texas and found some support. It's been quite an ordeal here. But we're so thankful to be back with our Courage sessions, and joining us going to be the Tmdsas new kid on the block, Baylor College of Medicine. And joining us today, we have a fantastic team. Just as a reminder, this is a live Q&A. So if you do have any questions for our panelists today from Baylor College of Medicine, please do feel free to post them in the comments section, and I will be moderating any questions that come in. And so we welcome you to ask questions as they come through. But just to kick us off, Dr. Johnson, would you mind introducing yourself and your team?
Oh, good afternoon. My name is Karen Johnson, and I am the Associate Dean of Admissions here at Baylor College of Medicine. I've been in this role for about 10 years. Prior to that, I was on the admissions committee for about 15 years. So I am a board certified neonatologist and hospice and palliative care physician, but my fun job, if you will, is admission. And next I'll turn it over to Claire. If you could introduce yourself.
Hi, everyone. My name is Claire Chappell. I am a third-year medical student at Baylor. I originally am from Dallas, and I went to school in New Orleans. Now I'm here at Baylor for medical school. I am also one of the student co-chairs, so I work closely with the admissions team to help run our admissions days, from the student interviews or the student socials, to student panels, kind of everything in between. So it's been really fun to kind of work with admissions this year, and I'm looking forward to being part of the cycle next year.
Mr. Mihave, why don't you introduce yourself?
Hello, everyone. My name is Mcast. I am one of the leads here in the admissions office. I have been here for almost a year and a half, and it's been one of the best blessings that I've had to assist everyone in this admissions office. Alexandra, please.
Hi, I'm Alexandra Gonzalez, and I'm the BSMD coordinator, and I handle all of our VAC-MD programs, including JAMP.
Excellent. Well, welcome to you all. We're so excited to have you here. And now here comes the $1 million question. Why did Baylor College of Medicine join Tmdsas? Other than the fact that we're so amazing, of course.
That was the first part of my answer. And also, as an institution, Baylor's been around a long time, and we've been with Mcast for probably 15 years. When we originally joined Mcast, it was, again, strategically planned. We have a lot of out-of-state students, and we wanted to keep that portal open. What we've seen over the last decade is that we are not getting applications from enough Texans. We want to see more Texas students at Texas undergraduate schools in our pipe. So to that end, we did not want to burden the applicants the way that we think they have been. For Mcast, if you're a Texan, you still had to fill out 2 applications, one Mcast for Baylor College of Medicine and one Tmd-Sas for all of our sister schools. We felt that that was too burdensome, and it was also interfering with more Texans applying because the burden of filling out 2 applications and the cost that comes with applying to 2 services. So we want more Texans in our applicant pool. We want to select and admit more Texans, and we think this is one step in helping us to achieve that goal.
Excellent. We're so excited to have you all. Of course, as we've mentioned before, we have collaborated in the past through programs like the Joint Admission Medical Program, and we'll get to the partnership that's already established there. But to see you all and have you all at the table to discuss kind of the future of medical admissions through Tmdsas is really a great gift. The more schools, the better, and the more support we'll be able to provide our applicants. So what does it mean for the admissions process for Baylor to be involved in Tmdsas now?
Well, one of the things that we are very happy about is that the timeline for the application process that we currently have for Mcast is very similar and parallel to the timeline for Tmd-Sas. So for those pre-health students who are going to apply to medical school, now that we're on Tmd-Sas, they don't have to think about, oh, when is the application deadline for Mcast versus Tmd-Sas? And so we think that part of the process will be smoother, if you will, because as we coordinate with our sister Tmd-Sa institutions, we're more aligned to have the same timeline that all of the applicants will know when to be alert to all of the different deadlines. So we think the process will be smoother because we'll have a timeline that is more coordinated with our sister Texas schools. And that's the pool that we're trying to draw. All of those Texans applying to all the Texas medical schools. So this will help it all to be more aligned and less bothersome.
Excellent. Now, as we all know, Baylor College of Medicine is a private institution and the first private institution joining Tmdsas. Here in Texas, there is a state statute that stipulates that at least 90% of the incoming class for public medical institutions has to be made up of Texas residents.
Yes.
Will Baylor have to abide by that?
A great question. And currently, our MOU, or our Memorandum of Understanding with Tmd-Sas, is that we do not have to adhere to that ratio of 90-10. Tmd-Sas has very graciously said, Baylor College of Medicine, you are the public medical school in all of this. Prior to joining Tmd-Sas, you have goals for how you configure your entering class. What percentage come from in-state versus Texas? So I want to say that no, we do not have to adhere to the 90% Texans and 10% non-Texans. But one of the reasons we're joining Tmd-Sas is because we want to attract more Texans. So that says that we do want to increase the percentage of Texans that enter our medical school, but we do not have to adhere to the 90%, 10%, just based on our agreement with Tmd-Sas at this point in time.
Great. Now, the flip side of that question,
Yes.
how are you making sure that this move to Tmdsas doesn't adversely affect out-of-state applicants?
Yeah, great question. And we have thought about it. There's always, consequences to any decision that you make. So with our leadership here at Baylor College of Medicine, our provost, our dean, we've actually sat and thought about that before deciding to go to Tmd-Sas. We really think that our diversity includes not just racial and ethnic, but we think geography is important. For students who are from Alaska and Idaho, who were born and raised there, to sit next to students who were born and raised in San Antonio and El Paso. That gives you exposure to different perspectives and different lived experiences. So we continue to want out-of-state students to apply because we do believe that they do enhance the diversity of our class, and we want that. Right now, our class size is 186. And it has been at 186 for a few years. And so if we're going to increase the number of Texans, that means that there probably will be less Texans overall. Having said that, and I know, and this is a different podcast, Mr. Hasso, but in the next couple of years, we hope to increase our class size because we're going to open our Temple campus. So we're looking forward to increasing the total class size, where we will not disadvantage the out-of-staters more because we'll have more spots.
Excellent. Thank you so much. And there is a question that came up as you were responding to that about the percentage of out-of-state applicants that are currently accepted. But I believe you just addressed, how that is being looked at, particularly in terms with this the addition of the Temple campus. Would you mind telling us a little bit more about that?
Well, we're excited, and there actually has been a public announcement that in the next couple of years, I think 2023, we will open a Temple campus. Our class size will increase by 40 for our Temple campus. So we'll, in essence, go from 186 to 226. So we're finally catching up with our sister schools. McGovern has 230 and so forth and so on. So in enlarging the class via that mechanism, again, that means that we can still maintain a nice percentage of spots for the Texans that we're hoping to attract through Tmdsas, but also still have spots for the out-of-state non-Texans.
And for those of you who may not know where Temple is, it is between Austin and Waco. And for those of you that are from out of state, Temple is between Dallas and Austin.
Very good. For me too, Mr. Hato, thank you.
All right. So just trucking along, answering some of these questions that we've received from our online community. Will Baylor College of Medicine participate in the match once you all join for the entry year 22 cycle?
Definitely yes. And that is something we are excited about. Over the years, not being in Tmd-Sas, how applicants are accepted, how they're made offers, when they're made offers, has not been as aligned with how we have made offers separately and distinctly. So another way that, if you will, we lose out on some of these great Texas applicants because they've already matched through Tmd-Sas with some of our sister schools, and through Mcast, we did not have a match per se. So we were still trying to, if you will, recruit those same Texans who've already matched at a great sister school, but now we're behind. And we think this will help us to have, more leverage with still attracting the best, most qualified Texans, and having us be a part of the match means that we'll be in the fray for being a part of them being accepted early in the match.
Wonderful. And it's such a great opportunity for all of the Tmdsas applicants because you do have a flat rate application fee, whether you apply to one school or you apply to all 13 schools in Tmdsas.
That's right.
When you look at other application services, the base application fee for Tmdsas is considerably less than a lot of secondary application fees outside of the state.
Very much.
So it's still very much a great value, and we're so proud to put in such a great effort, not just to make the process easier, but to make sure that we're not a financial burden on applicants as well. So this is just another example of how we're collaborating to make sure that this whole process is as unstressful as possible for the applicant.
Yeah, and Mr. Hasso, you made such an important point, and there have been enough surveys. We know that pre-health cohorts are extremely worried about how much it costs to apply to medical school. And those costs continue to go up. And that, again, was one of the reasons that our institution felt that we were burdening and putting, this onus on students who already are paying so much money to apply to medical school. And by going to Tmdsas, as you just said, that we help to minimize the burden of cost.
Yes. Now, that's a great segue to my next question, which all of these seem to be $1 million questions. So we're just making great headway and who wants to be a millionaire here. So let's say somebody does go through the Tmdsas match next year and matches to Baylor College of Medicine. And then they have the question of, how am I going to pay for this? Can you give us some insight into what tuition looks like at Baylor College of Medicine? It is, after all, a private school.
It is. And that is such a great question. And we are very, I'll use the word proud, that Baylor College of Medicine is the least expensive private medical school in the nation, which again is why we think that we attract so many out-of-state students. Because we have such an attractive, even for the out-of-stater, the non-resident Texan, but for the Texan, and I have it actually sitting in front of me, overall our tuition, fees, insurance, books, and supplies is about $33,000 a year for a private medical school, compared to other private medical schools that are usually $80,000, $90,000, $100,000 a year. So that's why U.S. News and World Report still ranks Baylor College of Medicine as the least expensive private medical school in the country. So for the Texan, of course, they, again, $33,000. The non-Texan is about $46,000. So it just gives you a little bit of insight. So even the 33 is very much so aligned with our sister medical schools.
Wonderful. I hope you heard the collective sigh of relief from all of the applicants out there. Now, this past year, obviously a lot of effects that have happened out of the past year have been really monumental. And we've had several conversations with groups such as Tour for Diversity about the pathway to medicine for people of color. And we're really interested in kind of learning how Baylor College of Medicine has really addressed inclusion and diversity in their admissions.
Now, one of the things that we have done, and it takes time, if you will, to our dear audience to have processes, procedures, practices to come to fruition. But in the last decade, we have noted in our entering class that diversity of ethnicity and race and lower socioeconomic status and first gens, and that we weren't making the inroads into having those students matriculate to Baylor in the way that we want. And so it began by holistically training the committee to review not just metrics and cognitive, but to very deeply look at the lived experiences and the attributes of every applicant. And as an institution, our diversity goals, which the admissions committee adheres to, supports, and is all about ensuring that we achieve those goals. We've learned through our holistic training, we actually had our admissions committee do a double AMC holistic workshop for a day a year ago. So sometimes you think you're doing things holistically. I think the workshop helped the admissions committee to see that we were skirting the surface, but we needed to be more intentional. And so some of our policies and things like that have changed as it relates to our goals. What we've also done is we believe some of our BSMD programs are pipelines for underrepresented, socioeconomically disadvantaged, which is one of the reasons we love the JAMP program, because we know it is a program for highly qualified, lower socioeconomic status Texans. The JAMP program we've been partnering and are big supporters of since its inception. We get great students, and again, it adds to our diversity goals to support JAMP. We've also onboarded 2 new BSMD programs to help achieve our diversity goals, HBCU undergraduate school, and a minority serving for Latinx students, Xavier University and St. Mary's in San Antonio. So as an institution, we've recognized that we've had some effort, but we aren't getting the results. So we needed to double down on that, which meant training the committee to really understand holistic and to look past metrics. And now let's partner with other institutions that can help our pipeline to have the diversity of race, ethnicity, but again, socioeconomic, first generation, and unorthodox, non-orthodox kind of applicants who come in the pool. So those are the things we've done to try to increase our efforts to achieve our diversity goals.
Excellent. Thank you so much for those insights. We know that it's a process. You know, we're trying to undo decades and decades and decades of policies here. So thank you for those insights. Claire, I think this question might be more for you, but can you discuss how you've seen diversity and inclusion addressed on the student experience side?
Definitely. I think so. I'm about to finish my 3rd year now. So throughout that whole time, I think from my first week at Baylor, the first thing you really do is our part of our orientation week is social determinants of health sessions. And so I remember when I did that as a first year, it was, a broad range of topics. And now that they have started to include a lot more things about diversity and inclusion and how that specifically relates to our patients and what things to be considering kind of from that perspective. And so that is one area that I know has, even in the 3 years I've been here, really expanded to make sure that they cover those topics and are really in the way that we should as, future doctors. And then additionally, I know that I've noticed in the last year, many of our clubs have started inviting speakers to come talk on a lot of these topics, starting those conversations. And then there's been a lot of opportunity for students to voice concerns they may have that are at kind of our level to faculty, deans, things like that. I think everyone has been very perceptive and very appreciative of kind of input. So I know several of my friends have been starting to work with student deans and things like that to sort of address some of these kind of experiences and things like that in our class. And so overall, I think, overall, I think Baylor does a really good job of listening to student concerns and taking care of us. So I don't think this has been, something or an arena where that's been any different.
Great, thank you. Now, we're shifting gears a little bit. We've talked about why Baylor College of Medicine has joined Tmdsas and gone over some of those logistics. But for a lot of folks who may have, been following the podcast and the Courage sessions, may not really know the educational or other applicant requirements for applying to Baylor College of Medicine. Would you mind giving us just an overview of the requirements to apply to Baylor College of Medicine, please?
Yes, and I do want the audience to also hear that we have a committee here at Baylor where we look at admissions requirements because medicine and medical education is a dynamic, fluid process. So medical education needs to grow and change and shift as we get evidence of what it takes to train the next generation. So our admissions requirements should reflect the current need of future physicians in terms of being able to be proficient in the knowledge and skills to be a qualified physician. So right now, and this I think has been going on for about 3 or 4 years, our admissions requirement include things like math, 3 or 4 hours. We ask for some humanities, 12 hours. We ask for expository writing. We have learned that future physicians need to be able to be very competent in how they write, and critical writing and critical analysis is crucial. We also, of course, can't get away from biochem, can't get away from organic, and that's true, you can't, and you shouldn't, because it's necessary, again, as a basic science foundation to kind of grow those skills to being a practicing doc. We do not require labs for our entering cohort. That was very intentional. This task force that looks at admissions requirements, we looked within, and our deans who teach the basic sciences didn't feel that labs in and of themselves would add anything to the students' matriculation. And for some students, especially students who have graduated, they're non-orthodox, they've been out of school for a while, we didn't want them to have to go back and pay a tuition fee to get a lab. So as long as you have organic and as long as you have biochemistry basic, then that's what we want. And as we mentioned earlier, we do not require, but we recommend Spanish if you're interested in the language. And we also recommend higher level science courses like molecular and cell biology and genetics. Again, those are not requirements, but as our task force of all stakeholders, especially the foundational science and basic science deans, we think that it will serve an entering student to Baylor College of Medicine very well to have higher level science, not just basic biology, but truly, something higher level.
Thank you for that. We've got several questions that need to follow up on, and I apologize. We're going to segue a little bit back to our previous section. Let's see. The first question, will Baylor still be on the Mcast application, or will it only be on Tmd-Sas?
Great question. We will still have Mcast for our MD PhD program. Now, again, that's not very dissimilar from some of our sister medical schools. So for those Texas medical schools that have an MD PhD program like UT Southwestern and McGovern, they also use Mcast. So Baylor College of Medicine will be primarily Tmd-Sas for the MD cohort, but for the MD PhD cohort, it will still be an Mcast application.
Thank you. We had a kind of more of a follow-up comment, and I'm interested to hear if you have any feedback on it. There's a concern that many schools say that they want to look at things holistically, but numbers are still incredibly low, particularly for African-American applicants.
Yes.
Now you mentioned that there are some pipeline programs in place, but I think that might be something that you might want to say.
Well, that's such a great question. And one of the things for anyone applying to any medical school, I encourage, whether it be students from large schools, traditional schools, small liberal arts schools, second career people, whoever is applying to medical school, irrespective of their background, you need to look at the school you're applying to and take a look at their curriculum. Because the curriculum is what is going to help you as an applicant to medical school to know or feel that this is the curriculum I can be successful in. And I say that because it doesn't dismiss that we need to be more mindful of not looking at metrics alone. We, admissions committee, and again, some ethnic groups and socioeconomic disadvantaged communities, some of the students in that cohort may have lower metrics, a lower science GPA and a lower Mcat. But again, if you're really practicing holistic admissions processes, that is here. Let's now look at the lived experience, this applicant's background, their interests, what are they going to bring to medicine, what motivates them to medicine. Let's learn a little bit more about the community in which they've come from. We know that is important to us as a committee because it adds diversity. And then we want to hear about their attributes. You know, what can they say about what their lived experience, how it has informed, their thinking about medicine and healthcare and what they want to do in it. So we do find that, and we at Baylor use Casper, which is a test, if you will, an online test, which looks at personal competencies. It looks at situational judgment and how you think about that. And one of the reasons we adopted Casper is because the data from the Casper developers is that Casper does not disadvantage underrepresented in medicine populations, lower socioeconomically status populations, older applicants. So we're trying to balance and be fair to every applicant. And it is honest to say that the cognitive needs to say you're going to be successful in a medical school curriculum many times are reflected in what your GPA and Mcat score are. They're not the end all be all, but to say you're academically prepared from a science perspective, those scores do in fact tell admissions committee whether, based on what your curriculum is and how rigorous it is, whether or not this student will be successful in your medical school. As you know, Mr. Hasso, some of our sister medical schools have 18-month basic science foundational sciences. Some have 24-month basic sciences foundational sciences. For anyone applying, they may think that their learning style for success might be better served by going to a medical school that has a 24-month, because the 18-month are more intense. And so each student kind of needs to look at whether they're Black, white, whether they come from traditional schools, Ivy League, small schools, whether they've been homeschooled or whether they've been out of medicine for 5 years. Look at the medical school's curriculum. Decide based on how that is presented to you if you think you can be successful there. Getting into medical school is important. Getting out is more important. And admissions committee have a responsibility to the applicant, first of all, to say if we think that this applicant will be, if you will, a good fit because of the academic credentials, the lived experiences, the attributes that they bring, whether or not this student is poised to be successful at Baylor College of Medicine versus one of our other great sister medical schools. So I just encourage, and again, we talk about the underrepresented in medicine and low metrics, and that is true, but I can honestly say at Baylor College of Medicine, our holistic review, that's just more information, but it is not the end all be all of why or if they will be accepted to our medical school. But we do know that we want the student to come and be successful, not struggle, not be, leave of absences because they failed all of their courses. That's our responsibility too. And so we take that very seriously.
Wonderful. Thank you so much for that response. It's a conversation that we've had with so many applicants, and particularly from special populations like underrepresented in medicine,
yes.
Non-traditional students, reapplicants, and really, if you are not sure about how you stand against the overall applicant pool and you're still an applicant, I highly, and I'm sure I'm saying this on behalf of everybody here, highly recommend that you go and talk to your health professions advisor.
Yes.
seriously assess where you are and assess any areas that you need to build up your application so that you're not having to go and apply and reapply just to try to get in to an interview. And I think Dr. Johnson really mentioned something really powerful here, particularly in regards to applicants in Tmdsas, is that you want to find the school that's the right match for you. And that's part of the reason why the Tmdsas match is something that's very helpful for our applicants, is because we're offering, obviously now 13 medical schools. There are 13 very distinct experiences there. If you, Dr. Johnson, if you look out your window and you see McGovern Medical School and you head down the road for 45 minutes and you see UTMB, or just 10 minutes down the road with University of Houston, or just up the road to Sam Houston, those 5 schools are significantly different, not just in student experience and curriculum and mission. And you really need to, as the applicant, the onus is on you to really find the school that speaks to you, to what your needs are, and how you're going to be able to leverage that admissions offer to make you a more effective healthcare provider.
Oh, that's a powerful statement, Mr. Hasso. And you touch on something that Dr. Horn at U of H said in a meeting recently as our dean. The school's mission is something you should be mindful of. So if you're applying to one of the Texas schools whose primary mission is primary care, then that may be what motivates you to apply. But if your mission, for example, is to be a researcher and to be a medical scientist, then you would apply to different medical schools. So the school's mission, and as Mr. Hasso says, in Texas, Texans are so fortunate to have so much to choose from, but you just have to choose wisely. And when you do that and apply wisely, typically you're successful in getting in.
Exactly. And all it takes is one school.
That's right.
All righty. So back to the discussion about the admissions requirements, and maybe if we could rewind about 10 minutes before we got on our soapbox about holistic admissions collectively. But you had mentioned the educational requirements to apply, and something that kind of stands out to me is the humanities or the social sciences requirements.
Yes.
Do you mind speaking to that a bit?
Well, I think we were not as before this issue as we should have been. Something my colleague Claire mentioned, that now, because we are more sensitive about teaching the next generation about social determinants and disenfranchised groups, and it's become part of the formal curriculum, if you will. We also just, how do I say this, Mr. Hasso? The new Mcat, the 2015 Mcat, which came after 25 years of an old Mcat. And it said, for 25 years, we have tweaked the Mcat so it can predict the students taking this test, taking these scores, will be successful in medical school. So Mcat 2015 came along after a lot of soul searching and a lot of blue ribbon panels coming together to say, what does the next generation need? And we need to develop a test that will reflect those needs. So something like Claire said, we know medical education, we have been short-sighted in teaching the next generation physician how a person's social status impacts their health more than almost anything else. So the new MCAT was designed to test the proficiency of knowledge for a future physician along those lines. We know that, and one of our deans, Dean Goodman, says this all the time, 10 to 20% of our health outcomes have to do with our genes and our genetics. The rest of it comes from social determinants: where you live, how you live, what you do, what you don't do. So we've learned in medical education that psychological, social, behavioral aspects of the patient are crucial to their health and wellness. So we need to teach the next generation doctors to be as proficient in that as in biochemistry. And that's why the MCAT 2015 was redesigned to include psychological, social, and biological basis of behavior, because that truly is what, more than anything determines the individual's health and wellness outcomes.
Bravo. Well said. Thank you. All right. Another big question that is being asked, I've had about 3 different ways that this was asked, but essentially, will the policy of accepting AP credits apply to Baylor applicants? So, sorry, let me rephrase that question. Essentially, some schools will allow AP credits to fulfill prerequisites in Tmdsas. And so the question is whether or not Baylor would adhere to that as well.
We will not. We think we disservice our matriculants. AP is wonderful, and certainly and I do know that there are some Texas statutes as it relates to how AP credits are accepted by undergraduate schools, and we have no control over that. We simply want the person applying to Baylor to be as well tooled to be successful in our curriculum. So we truly believe that taking the undergraduate course, not AP credit, will help that student to have a more depth of knowledge as it relates to that particular required course. We think the required courses, we don't want them to be burdensome or prescriptive, but we believe that they truly enhance the knowledge that is going to be needed to get through our basic science, foundational sciences. And we just don't feel AP and AP experiences have that depth.
Thank you. Now, just another one of those big questions that is lingering on everybody's heads right now has to do with COVID-19 and how different things, different activities, courses, all of that has been affected by the pandemic. So question 1, how will Baylor College of Medicine assess a kind of a lack of activities relative to previous cycles due to the reduced access to enriching activities during the pandemic?
Oh, for the applicant, you mean, Mr. Hassa?
Yes.
Because I'll turn it over to Claire to tell you how the matriculants are dealing with this kind of new world. But from an admissions perspective, and Claire is one of our co-leaders on admissions committee too, so she can really speak to both. But we, as an admissions committee, have adopted, and it has been our mantra all of this cycle, flexible. We got to be flexible. And we want to look at each applicant as we do every time individually. We don't have a specific question about COVID on our application in terms of how that's affected you, but we do know in the Mcast application that we have had many of our applicants write that they didn't have as much volunteering or clinical observership. Their summer research was canceled because of COVID. They might have done it virtual or nothing. So we have, as a committee, acquired and believe that we have adhered to it and are going to be faithful to it, that we understand that the applicant had no control over any of that. We do like to see, however, some maybe innovation, some be novel, find a way to get some exposure to healthcare. And that's one of the things, we talk about. There's this big push that I've got to shadow, I've got to shadow, I've got to shadow. It's hard to shadow virtually in Zoom. But maybe even if you can't go into a hospital setting right now because COVID restrictions are very tight, but maybe you can find a great pharmacist at CVS who is willing to let you observe what they do over the course of the day. So, interprofessional teams are an important part of medicine. And we love that here at Baylor College of Medicine. We have our School of Health Professions and we've got our Graduate School of Biomedical Sciences. So our medical students sit next to their peers from other aspects of healthcare professionalism to learn more about them, to learn more about each other, because as a team, they're going to be more effective in the patient having the best outcome. So just try to find a novel way to be exposed to medicine, to be exposed to healthcare. We do see a lot of applicants these days, and whether it is because they have less exposure or they really want the money, we have a lot of students applying who are med scribes. And so medical scribes are out there. They have to be in the patient care arena. That's their job. But they can also put that on their application, and that tells the committee, an admissions committee, that they had up close and personal observation of true patients. And so just look for any opportunity. It doesn't have to be shadowing a doctor, but try to get some clinical exposure. Shadow a nurse. a dentist. And again, the committee, it's not about how many hours you shadow, but however few in these days, just write, how has that experience informed your decision to want to be a physician? So that's one of the things that applicants sometimes think, I'm going to get 1,000 hours of shadowing. Well, if you only have 10, but they're rich, and you can write in your application how it affected you, what you learned from it, how it informed your decision to go into medicine, that's what admissions committees are looking for. It's not quantity, it's quality. So if you can find a quality exposure experience, even in the face of a pandemic, and just write about it, admissions committees, I think, will be very overwhelmingly happy to receive in a good faith way that you did all you could do in this circumstance.
Wonderful. And before we get to Claire to kind of discuss how the student experience has changed due to COVID, we have one more follow-up question regarding the admissions process. How does the committee view any gap years? I hate the word gap year. I think it's more of an enrichment year. It's a challenge for yourself to be better. How does the admissions committee view these enrichment years?
Well, it's been evolving. I will say that. Probably 5 years ago, it might have been a little bit of a red flag. Why does this student, if you will, need or want to take a gap year? But fast forward, we've learned, using your words, Mr. Hasso, that some applicants to medical school feel that possibly some of their undergraduate experience hasn't tooled them for their application to be as strong and as competitive as they wanted to be before getting into the pool. So they're going to take a gap year. And it doesn't mean that, they want to take the Mcat over. It may be in their undergraduate because they were a non-science major. Maybe they feel that I need to do a year of trying to do some sort of research so I can learn to think like a scientist. So I'm going to take a gap year, become a research assistant in a lab, and then I'll know more, but I can also put on my application, since my undergraduate opportunity for that, I just didn't avail myself of it because I was a history major. And at Baylor College of Medicine, we do think diversity as well comes through people's interests, people's perspectives, and majors reflect that of the undergraduate cohort. So in our entering class, we have as many as 30 or 32 different majors. So a lot of our students come from non-science majors. So they might not have the student who's a religious major or a journalism major or a business major may take a gap year just to, again, enhance their exposure to medicine, healthcare research, and also that gives some depth to their application. But they also learn a little bit more about the profession that they're going in. So admissions committees think of it now, it's almost the new norm. I think we looked in our entering class last year, there were about 30% of the class who had gap years. And they were looked at favorably from the first look on holistic admissions process until the last.
Wonderful. I'm sure a lot of non-traditional students in particular are excited to hear that. The last question, one more here. And I know you alluded to this earlier, but how is virtual shadowing viewed by the admissions committee?
Again, we view it as someone who's thinking outside the box and being creative. And we love people who think outside of the box and are creative because that's medicine, that's healthcare. So that's why if you've done something innovative and it is a shadowing or clinical observership type experience, even if it's virtual, write about it. The committee wants to hear about it. You have gone over and above. You didn't just sit in your room and say, COVID, I can't do anything. No, you said COVID, but I'm still going to apply to medical school. And these are some of the things I'm going to try to do to be exposed. So, reach out to your community of peers and your academic advisors. Sometimes a lot of your undergraduate cohort has found, an inroad into some kind of virtual shadowing or something. So networking with your cohort and your academic advisors, you may find some ways to do some innovative shadowing and clinical exposure observership, and the committees will be very, very happy with it. They will be. Until we're beyond this pandemic, this is the reality, and we should not disadvantage the applicant because they didn't have 1,000 hours of shadowing. If they just got 10 hours of virtual shadowing and they can write what they learn, including the challenges of a virtual experience, and that's why we like creative writing and expository writing. So those are the things that admissions committees will look for and look at and accept on its face as a good faith basis.
Great, thank you. And now finally, we're back to Claire, where we can talk about the student experience. I apologize, I threw in like 4 additional questions before we came back to you. But
no problem.
How has the COVID experience changed the student experience?
Yeah, so right now I'm in my clinical curriculum. So I've been working in the hospital. So actually I've been off for 7 weeks now. I took my step 1 exam yesterday. So I haven't been around in the hospitals, but when COVID kind of everything started to hit last spring, I was on my internal medicine rotation 2 weeks in, and they pulled everyone out of clinics. And so we were all, well, what's going to happen? What are our requirements going to be? Are we going to finish this rotation? Do I have to make those 2 weeks, start them over? And one thing that our curriculum deans did an amazing job of was communication and being flexible. So they turned it around pretty quickly to they created the COVID curriculum. So basically what they said was, since everyone is not in clinics right now, what we're going to do is we're going to create an online curriculum for everyone to partake in for the 2 months that we're out. And during that time, we kind of got exposure to everything. So you did online casework in internal medicine and in pediatrics and all sorts of random things to sort of get us back on track. So I believe it was August, we were back on our schedules to where what I was supposed to be on in August, the beginning of the year, was same. It was not shortened anymore. It was no longer, affected in that way. So I really appreciated how they did that. As for being in the hospitals, they did a good job of kind of encouraging our attendings and residents to, hey, if there's not active work to be done and there's things that they could maybe just do at home of chart review or something or other, to, have us not be there so that we're not physically in the hospital as much. And then as for preclinical curriculum, I know that they've, some of it was already, designed for that because a lot of people will stream classes anyways. But one thing that I think that was really important to Baylor was keeping the anatomy curriculum in person. And so they worked around a way to make sure that every student still had in-person anatomy labs. So instead of having 2 days of anatomy, now it's spread out over 4. And so they've been very flexible. I think that's kind of been the like driving theme, like Dr. Johnson said. And I think that the biggest thing that they've done is been really good about communicating with us. So it's been, uncertain at times, but I felt like my education has not, wavered very much and probably has gained a little bit just from having to go through this experience during medical school. It's been very unique.
It's good to hear that there's just as much care with the actual student experience as there is with the admissions experience. So since we're talking about the student experience, we'll go ahead and jump into that section a bit. Obviously, there are so many students right now hearing about Baylor College of Medicine. You were there at one point and kind of envisioning what this building looks like and what the experience is there. Can you talk to us about what the difference is between your expectations for Baylor College of Medicine and what you're actually seeing?
Yeah, I feel like when I came to Baylor, I had kind of just this, I don't know if I really even had much of I just kind of was very, okay, you're going to medical school, you're going to be here for 4 years, you're going to put your head down, and Baylor's a good school, so you're going to come out this other end as a great doctor. It's kind of my expectation. And I think Baylor kind of blew me out of the water a little bit just from the care that they take very early on to welcome you into the Baylor community. I think, I think I always knew, oh, your medical school will support you, et cetera. But the way that we have our retreat is done from the get-go with our peer resource network programs, where you have second and third years and fourth years who are kind of built in to give you advice and be there for you. I think that really shaped my experience for the better and helped my transition to medical school be a lot less rocky than it might have been. And so from that respect, I think it really, exceeded my expectations. But, kind of have been looking back just because I have been on this study break, and, you know, Baylor, we do our curriculum differently than other schools where I've been in a year of clinics, whereas most of my peers take this exam after their pre-clinics curriculum before entering clinics. And I think that the way that Baylor has prepared me just not only for being a clinician and being in the hospitals, understanding how that workflow goes, but also with the knowledge that I need. It's a really good balance, and I don't feel like I've had to sacrifice one for the other, and I've been really appreciative of that.
Excellent, thank you. And when we were learning a little bit more about you earlier, you were talking about how during interview day you helped put together some of the social activities. Can you walk us through what interview day looks like in terms of the social activities, and then we'll scoot over to the actual interview day discussion after that?
Yeah, so our interview day, we have an interview social the night before, which we made virtual this year, obviously. So kind of had a little breakout room situation, and our applicants got to speak with a couple different Baylor students, get a lot of different perspectives. And then our interview day is always on a Friday. It starts at 11:45 noon, which is a later start time than most medical schools from like what I remember when I was applying. But I feel that just having an afternoon allows us to really just hit the points that are important and focus on, you know, not dragging it out for the applicants too much and just, you know, inundating them with information. And so we have our one of our deans welcome, and then they have their live interview that day, and then we do a student panel and a student like optional tour that we've done virtually, and we've been working on because of COVID and people haven't been able to come in person. We've been working on making, or we haven't, our communications team, I believe, is working on this, but they made really great like dollhouse models of walkthroughs for admission or for the campus. So you can kind of click around and see where everything is, and it's almost as if you're walking through. So our interview day is, I think we've gotten good, you know, I've enjoyed being a part of them, so.
Excellent. And for the staff there, what does the interview day look like? I know we've kind of gotten a quick overview there, but right now I'd imagine interviews are virtual, and if we could throw in whether you're looking into your crystal ball and seeing if they're going to be virtual this next year as well, if you could toss that in.
Right. So I guess just, you know, based off what Claire just shared, you know, we did already understand that it is kind of stressful for the applicants currently in terms to just dealing with the online attribute of the entire process, you know. So what we ended up doing was just figuring it out, like get all of the applicants into one main room and just avoid them from stressing out altogether. So our staff members would end up just manually placing them into their breakout rooms with their interviewers, so they wouldn't have to do a thing. They would have a 25 to 30-minute interview. If any type of technical issues did occur, they were already instructed to swap phone numbers, and they can complete their interview via phone. We just kind of wanted to make sure that everyone was comfortable throughout the entire session. And in terms to your question for this coming cycle, unfortunately, yes. You know, we really don't want to. We really do miss seeing all these applicants and giving them actual live tours. You know, we would actually feed them as well, you know, validate parking. We did all the works. But unfortunately, this year, we still need to take this year in stride and just really make sure that everyone is safe. So yes, unfortunately, we would end up doing this again. But through your system, you know, I'm assuming this is going to be completely easier, completely better, and completely stress-free.
I don't know about completely stress-free, but we'll work on it.
And if I can just add to my colleague, Ms. Mihave, because we are going to Tmdsas, we will, for the next admission cycle, have 2 30-minute virtual interviews. As members of Mcast, we had adopted the Vita interview platform. So this past year, because of our Mcast affiliation, we did take advantage of their Vita tool, and that allowed us to have only 1 30-minute virtual interview. Still a lot of work for Mr. Mihave and Ms. Gonzalez, capturing all those VITA interviews and teeing them up so we can see them and re-see them. So again, something we're looking forward to being with Tmdsas. It'll be a little less complicated. And as Mr. Mihave says, we think in general, it will serve every platform better for us.
Excellent. And I'm including a link here about an article we did on virtual interviews, preparing for those and making sure that you understand what VITA is. And obviously this was the year that you all did it, but next year you will not be doing VITA. But just in case you're wondering what all of these acronyms are, we included an article that kind of goes over a few of those. Okay, we have a last section that we want to get through, and I apologize. We're kind of running out of time, so we're going to have to go through this one a little bit quickly. But for special programs, could you tell us a little bit about what those partnerships look like? I know we've talked about the special pipeline program with Xavier University, and also the one with St. Mary's University.
Claire, do you want to talk a little bit? And do you mean, Mr. Hasso, partnerships with other institutions or some of our special programs within for matriculants?
I think this would be for pipeline programs.
Okay, well, and we do. We've had pipeline programs, BSMD programs for 30 years here at Baylor College of Medicine, and we believe they do help us to identify a cohort that comes through that pathway. We do, again, try to, diversity goals for our institution. We believe that's an opportunity for us to enhance our diversity goals through some of the pipeline programs. So we have one, of course, with Rice, which is the one that's 30 years old. We have one with DeBakey High School and University of Houston Honors College. Of course, we have one with Baylor U in Waco. And I'm missing one, guys. Yeah, that's it.
Cool. Xavier and St. Mary's is
yes, those two new ones. But just something that I'm sure the audience knows, we have for 20 years had a BSMD program with UTRGV, but that program is retiring in the next 2 years. So I still have this instinct to just say we have that program. So I apologize. It's been a great partnership. Our grade school now has their own medical school. So we are so happy. It's another one of the 13 schools, but our BSMD program will retire and we will have the 5, which as Ms. Gonzalez says, includes Xavier and St. Mary's. And we look to onboard some more in the future. And of course we have JAMP. And JAMP brings us, students from 30, 40 different private and public, undergraduate institutions, big and small, and again, highly qualified, lower socioeconomically disadvantaged Texans who come from so many different backgrounds. And so we consider that a pipeline program and that we partner with the state of Texas and support totally. But we do know it's growing and we look forward to it growing to where we can continue to get good students of diverse backgrounds through it.
Wonderful, thank you. And I know we only have a couple of minutes left, but I really want to make sure that we made a little bit of time to at least acknowledge the existence of some of the really great, unique, specialized pathways that Baylor College of Medicine offers. And I'll include a link, but if you could just give us the very short summary so that we don't use your time ineffectively today.
Yeah, so we have a wide range in that you can look through the list that you'll provide, but essentially the way that I think of these pathways are kind of like minors. So they're not something that's a requirement for Baylor students. And it's just something that allows you to explore an interest further. So for me personally, I've been involved with the genetics pathway just because I've seen that as a growing field in medicine, something that I wanted to have a better foundation and understanding for. But I'm planning on going into a surgical subspecialty field. So not, really near that realm, but I saw the value that could give me. And so being a part of that pathway has allowed me to be more involved in the department and see, their lectures and those kinds of things. And I think that's the real benefit of these pathways is that it allows you to get more exposure. So we have our global health pathway that works with the Tropical School or National Tropical School of Medicine. And you can get a certificate and in that, and I think it's a certificate in tropical medicine. So if you're interested in that and you have an opportunity to travel, we have the Care of the Underserved pathway where you do a rotation specifically in that, in Houston and work with those populations. So there's really something for anyone if you're interested in them, but I think they're very manageable. Most of them, you take a couple courses in your preclinical years and then either complete some sort of project or go on some sort of elective rotation. And it's really unique to each one. They all have their own different things, but I think they're very valuable. And I have a lot of friends who are involved in them and, and things that they're not necessarily going into, but things that they just find interesting and know add value to their education.
And just space medicine just sounds so cool.
Space medicine. That's a great one too. Yes.
Yeah. All
they
right.
get to go to NASA, and that's a really cool opportunity.
Right.
Excellent. And if I could ask just that one last question that came in, yes, no, does Baylor offer scholarships to medical school students?
Yes. Both merit-based and need-based.
Excellent. And we'll include a link in the recording of this for anybody that's interested in learning more. Before we let you go, I wanted to offer you an opportunity to just drop a nice word of encouragement to any applicants right now. I know this pathway is scary to begin with, and right now it's especially terrifying with so much uncertainty. What words of encouragement do you have for any applicant out there interested in Baylor College of Medicine?
Wow. Well, for anyone interested in pursuing healthcare as a whole and pursuing medical school, I want to implore you by saying we need you. I think the pandemic has given everyone an opportunity to see how healthcare and the need for great healthcare providers is something we have to focus on. You cannot have a healthy community, a healthy country, unless you have great healthcare professionals. So we want a physician workforce that is very diverse, and that begins with having a medical student body that is very diverse, and that means each of you. You each have something unique. Trust me, we get so many questions from applicants. Well, what does the admissions committee want to see in my essay? Well, we want to see you. Tell us. Everyone has a story. Everyone has a narrative, and it is important. You may think your story is dull or blah, but your story is what we need to hear, because that's where your uniqueness as an individual, your uniqueness and your lived experience will add to the overall healthcare workforce of physicians. So please be encouraged to know that, number one, work with your academic advisors, talk about your strengths, your weaknesses, focus on what your goals are, learn what your learning style is. It may not be the same as your best friend. So do what you need to do to be successful in your degree granting program with the guidance of your academic advisor, and you'll be successful and you'll have great credentials. While you're in college, look at those extracurricular and co-curricular activities. We are looking for leaders in medicine. And leaders in medicine means in your undergraduate world, you're not just in an organic class and you're not just studying for the Mcat. You are out there, you're in the community, you're being of service, you're leading, you're working and volunteering. And just know that, all of those things will strengthen who you are in your application, and don't be discouraged. Just know that it is a goal that you can achieve, and you can. I have seen it over my 20 years. Know that you have first the desire. Now you just need to get the tools. And part of the tools are coming to a podcast like this to learn more. Part of the tools are when you learn things, go talk to your advisors. If you don't have an advisor, find a resource for what does it mean to apply to medical school. In the 21st century, there are lots of resources. So please just be encouraged to know that you can be successful going to medical school. It's not about your grades. It's about everything about you, the person that you are, what you bring to the profession, what motivates you, what you can contribute to the health and wellness of all people. And know there's a place for you in medicine, but it is hard work. We have to just be honest about it. It's hard work. But look inside yourself, do some soul searching, and you'll know if this is the right pathway for you. And if you know it, you start it, you'll be successful in it. I truly believe that.
Wonderful. We're going to make a little plaque of that, make a poster, put it up in every pre-med room. Thank you all so much for your time today. This was very insightful. We covered a lot of ground. And of course, this recording will be available on our podcast, Inside Health Education Podcast. And on behalf of Baylor College of Medicine, Tmdsas, the Texas Health Education Service, and JAMP, we'd like to wish each one of you all of the best of luck this upcoming cycle. We're here to help. And as Dr. Johnson said, it's not going to be easy, but it's definitely going to be worth it for you. So thank you all so much.
Good luck, everyone. Thank you, Mr. Hasso.